We are live. Good morning. This is Amy Landau from North Shore Acupuncture Center, and this is the last discussion in a series of discussions that we had about being perimenopausal in the pandemic. So great time to be perimenopausal. And today we are going to be talking about sex. Yeah. So let me introduce you to my guest with me today. But before I do that, you do not have to be in perimenopause to get value from this conversation. And you don't even have to be a woman. So please stay on. Don't feel like you have to be in perimenopause to relate to this topic. And if you have any questions, go ahead and put those in the comments, and I'll try to monitor those and bring those to Jennifer's attention as we get a chance. If you are watching this after we are no longer live, still put any questions in there, and I can see if I can get responses for those to you. So Jennifer, thank you for joining us today.
Thank you for having me.
Let me tell you guys a little bit about Jennifer. So Jennifer Litner is an ASECT certified sex therapist and human sexuality educator. So she helps people who want a more vibrant sex life to speak openly, deepen their connection and love energetically. She believes the sex life you desire is worth striving for. And just before we get started, from a Chinese medicine standpoint, having a healthy sex life is important for your health. It's one part of your overall health. And so people will, I always ask people about their sexuality, and they'll say things like, oh, I don't have a partner right now, so I don't have a sex life. Well, that actually is an issue, and you can have a sex life without having a partner. We won't be talking about all of that necessarily unless you guys have questions about that, but I just want you to understand that having a sex life is actually important for your overall health. We were created as sexual beings, and that's an important aspect of your health as well. So if you don't have a sex drive, or if it's crazy, that is something that we should talk about as well. But Jennifer, can I start just by asking some questions?
Sure, yeah, fire them away.
So I get some that these are some of the more common misconceptions, I think, or questions that I get too. One is this idea that menopause means the end of your sex life. Is that true?
No, that one is definitely false. I think a lot of times during menopause, there are changes happening in our bodies that are greatly changing the way we have sex. And so some of those, somebody who might be having irregular periods, or particularly in perimenopause, or hot flashes, difficulties with vaginal lubrication, those things can certainly throw people for a loop and make them think, well, let me just throw in the towel, like my sex life is over. But that's not true. There are a lot of things that people can do to change the way that they have sex, or to treat some of these ongoing issues so that they don't interfere.
Okay. So vaginal dryness is definitely one that comes up. Mm-hmm. I know it's probably different depending on the individual, but do you have some general advice that you give people that are struggling with that?
Yeah, so vaginal dryness generally occurs because of the decrease in estrogen. It really is what sustains the healthy lubrication. And there are a number of things over the counter one can do. Vaginal moisturizers are very important, and that's different than a lubricant. So a vaginal moisturizer is something that's applied to help help the tissues repair themselves and moisturize, bring water to those tissues. And that is applied before in anticipation of sex, whereas a lubrication is applied like during or directly before. It's important to pick a lubricant and moisturizer that are going to be FDA approved, and ones that are actually going to do more positive things than harm, right? So we know that we'll talk about moisturizers first, then lubricants. So moisturizers, a lot of them have a lot of different ingredients in there, and some of them can be irritating to the skin. And the last thing you want to do is go buy a moisturizer or a lubricant that's going to cause atrophy or deteriorate the tissues even more so. Like, that's not going to obviously help the issue. So I generally recommend the Replens long-acting moisturizer, and Reverie also has a good one. Anything that has hyaluronic acid, which is a compound that helps rejuvenate skin, it can be helpful. But the Replens one and the Hyalogyne Vaginal Hydrating Gel is a really good one for moisturizers. And then for lubricants, I would really recommend Slippery Stuff or Good Clean Love. Both of those have what's called low osmolality, which is basically a scientific compound that talks about how it's created and can cause further dryness. So basically, these two have low osmolality, which helps not dry out the tissue and not cause irritation. So those two would be my go-to first steps.
Okay. And if you're using condoms, is that a concern with any of those products that could break down the condom?
So the water-based lubricants that I talked about, Slippery Stuff and Good Clean Love, are the two that I tend to recommend because they are water-based lubricants and they're condom compatible, meaning that they will not degrade condoms. There are a handful of lubricants that are silicone-based, which can be actually really great. Again, you want to look out for any kind of harsh ingredients, but there's not issues with osmolality in that because they're not made of water and they're made of silicone. Those ones you wouldn't want to use with a condom, but for the water-based ones, you'll be okay.
Okay. All right. So another question I get a lot, and I can answer it more from a Chinese perspective, but what if you have no desire for sex? Any recommendations for that?
Yeah, so there's so many things that can impact desire. It's one of these like overarching concerns that can have a lot of different reasons that can impact it. But so when someone says, I have low desire, I tend to have like 5 to 10 questions for them follow before I give them a direction of what might work. But the first thing I would want to know is like, has this been happening throughout your life? Is this something that's newer? And what are some of the things that get in the way of desire, or what I call like desire blockers? Emily Nagoski, who's a writer and researcher, wrote a book called Come As You Are and talks about this being like a system, like as if you're driving a car and having brakes and gas pedals, which I think is a helpful analogy. So whenever there's something that's a sexual brake or something that's getting in the way of our desire, for some people that could be having the stomach flu. For other people, it could be stress. It could be fatigue. It could be a lot of things. We need to address those things first, because you can try to seduce your partner or get in the mood as much as you can, but for as long as something that's inhibiting that desire is showing up, it's not going to do it much good. So there's some good pragmatic things one can do around that. That would be my first go-to.
Okay. And then I think for some people, one of the things that you might get to is they just don't feel sexy anymore. And so they're trying to figure out how they get their sexy back.
Yeah.
Stella got her groove.
Yeah. So when it comes to getting one's sexy back, I think there's a couple things to think about. Like, what does it mean to be sexy or to feel sexy? What has that felt like for someone in the past? And, can they get creative to trying something new? One of the things I hear a lot from people is just frustration with sex life changing. And what used to work for me 10 years ago doesn't work for me now. And that can be really frustrating, especially if you're used to engaging a certain way, whether it be through solo sex or with a partner. And one of the things I often tell people is that sexuality evolves just like we do as humans, right? The way that we care for our bodies changes, the way that we live our lives changes to kind of keep up with what the information we know. And that the same is true with getting one's sexy back. So I try to help people connect to something that feels pleasurable. Maybe thinking about what kinds of things would be exciting for them. Going to a sexy workshop can be fun. Thinking of erotic stimulation can be great. There's a lot of different ways to explore erotica. So I think it depends on like what someone's openness is to some of these things, but trying to look for something new to try.
Yeah, I think one of the things I found, especially as I get older, is just the importance of being in my body. Mm-hmm. So you talked about stress and all those things, and that can get you more in your mind than in your body. So just spending time doing things like walking in the grass barefoot, where I'm like really grounding and feeling feeling things or eating raspberries, just things where I'm engaging my senses in a pleasurable experience, like you said.
Mm-hmm.
And every time we experience pleasure, whether it be laughing or an orgasm, we get little bursts of nitric oxide, so it improves our immune system and a lot of other things too, which is an important reason to have sex because it improves your immune system. And that's something we all want right now as well.
Yeah, and I think that this idea of incorporating mindfulness is so important when it comes to pleasure. So one thing I often have people do that I work with is to give themselves a hand massage and to just notice like what the sensations feel like. Because a lot of times when we apply different types of stimulation to our bodies, they feel different, and we may not always notice that if we're always going for the same thing. So I like this idea of like putting your feet in the grass and noticing what that feels like. But there's so many different things we can use as sensory objects or tools to help with that.
And then another thing that I think happens more sometimes as you get older, people notice a decrease in sensitivity, either in their nipples or their clitoris. Yeah. Any recommendations? We actually talked about this a little bit when we had the doctor on to talk about hormone replacement therapy.
Oh, great.
And so she emphasized the importance of increased blood flow. And sometimes that means, maybe you haven't been as active sexually. So just practice and pleasuring yourself. The more you do it, the more it brings that blood flow back to the area. Yeah. But anything you would add on to that?
I think hormone replacement therapy can be great. There are a lot of topical type of options too. A lot of people feel worried about using estrogen, especially if they've had any type of breast cancer or something like that. But a lot of the transdermal options are really helpful. There's also pleasure devices that are, or accessories as we might like to call, such as toys that can be really helpful and provide stimulation at a level to which it might be hard to do so with one's hand, mouth, body, what have you. So I think that being able to find some really quality sex toys or devices could be helpful too, because they do, when intense stimulation is applied to the area, we know that blood flow will follow.
Okay.
Yeah.
So if people haven't used sex toys before, where do you recommend that they go to learn about what might be beneficial for them and, where to buy them, things like that? Is that something you talk about with clients? So it's good to come with you to just talk about overall everything, and this is one piece, or how do people get started?
Yeah, that's a great question. So I would go to a sexuality retailer that has sexuality educators on staff to help people guide them through the purchase if they want a live visit. And we have 2 sexuality retailers on the north side of Chicago that I really recommend, specifically because they're close to my office, and that's where people tend to go, so they might go before or after an appointment. One of them is called Early to Bed, and that's in Andersonville. And the other one is called the Pleasure Chest, and that's in West Lakeview, Roscoe Village area. And both of them are great options. They both have websites too. And there are a number of other sexuality retailers out there. We have a bunch linked on our website in the resources, the Embrace Knowledge tab, if you will. So I would direct people there, but definitely a sex positive sex toy company would be my place to go, as opposed to just a larger search engine or something like that. Yeah.
Or Amazon.
Yeah, I don't like to throw out companies here and there, but I do think that there's a really big difference when you go to a store that specializes in helping people navigate. Okay, what type of stimulation are you looking for? And you can in a COVID-free world or post-pandemic, I suppose, there's testing out toys and on one's skin to see what the stimulation feels like, and that can be helpful, because especially if this is a new experience for someone.
Yeah. Yes, this is, I encourage people to shop local as much as possible, and this is another area where you're always going to get better service shopping local, and those are the people that will help you in situations like a pandemic versus a larger company.
Right.
So if you have questions for Jennifer, feel free to put those into the comments. Are there any other common questions that you usually get from women around this time of life in perimenopause that we've missed?
I think the piece around lubricants is something that I address that people don't often know about, and around like the osmolality and purchasing, like so many like really well-known companies that produce water-based lubricants are not safe in the sense like they're not FDA approved or they can cause damage to the tissue. So really being educated about the choices you're making and as a consumer is one thing. And then I often get questions about pharmacological treatments for desire, because there are two treatments that are available. There's Vyleesi, which is an injection, and Addyi, which is an oral medication for hyposexual desire disorder. And, you know, they can be helpful. It's not my first line of defense by any means. And I'm not a medical doctor, so I don't prescribe medications. But I do think that for some people, they might be the right choice. And for other people, they're not. So I think I get questions about those things in relation to these topics too.
Okay. Another thing that sometimes comes up that I think we can just reiterate for this group is people having pain or experiencing discomfort at this time of life and thinking that that is something they have to put up with. So we talked about that. I had two two physical therapists that specialize in pelvic health. So they talked about the fact that that isn't something that is normal. You want to address that, and they can help with that. Along with, you know, sometimes it could be because of the vaginal dryness, and you address that. Anything else you would add to discomfort?
Yeah. We work really closely alongside pelvic floor PTs to help just make sure we're providing collaborative care. So I think a lot of people feel nervous about like what to expect from a PT exam. Like they're used to going to PT for a knee or hip replacement or something like that. And they're like, what is PT look like with the pelvic floor? And, you know, the pelvic floor is so connected to the rest of our bodies. It's really important to be able, you know, even how we're sitting can impact like things, right? And so I think it's really important to be able to get your treatment team in order, so to speak. And I think the value of sex therapy can be really, really helpful. Like we know that outcomes tend to be greater when someone's working with a PT. They're also, you know, their gynecologist or their practitioner, their medical practitioners are looped in, as well as their psychotherapists. So really finding people who specialize in the concerns that you're experiencing, I think is really important, because they'll be able to deliver that comprehensive specialized care for you.
Yeah. So if you are experiencing that issue, all of the videos from previous Facebook Lives are on perimenopausalinapandemic.com. Okay. So you can go there and find that one about pelvic health. This one will be at perimenopausalinapandemic.com eventually as well. I'll download this so you don't have to come back and find it on Facebook if that's hard to do. They're all on my North Shore Acupuncture Center YouTube channel, along with other series if you're having sleep issues or things like that. Yeah. So it looks like we don't have other questions. Can you tell us more about your practice and how people can work with you and the best way to follow you if you're active on social media, all of that?
Sure, yeah. So we offer psychotherapy, individual, relational, and sex therapy. We predominantly work with people and their partners or individual adults. Most people come to see us for sexual functioning concerns or intimacy-related concerns, but we work with anyone around any kind of sexuality-related concern. And then we also do sexuality education programming. So we offer sex-positive parenting workshops for parents who want to talk to their kiddos about sex. We do a fun workshop on keeping the flame alive in long-term relationships, which is a pretty popular one. And we do educational talks for healthcare providers as well, and being trauma-informed in their practice of care. There's more information on our website. So if you go to embracesexualwellness.com, you'll find more information there, and that's probably the best way to contact us. We are on social media as well. So it's Embrace Sex Wellness on Facebook and Embrace Sexual Wellness on Instagram. So if you want to connect with us there, that would be a great way to stay in contact. We try and share information that we find helpful and we hope will help others in the community.
And so the workshops you talked about, can you find those? Do you put those on the website, or where's the best place to?
Yeah, so if you go to our website, there is an Embrace Psychotherapy tab that talks about the psychotherapy services. There's also one that says Embrace Sexuality Education, and a whole host of our talks are on there, as well as we do take custom requests. So we've done everything from sexual harassment trainings to, talking to parents to my teen, is starting to be sexual, one needs to learn about consented boundaries. We do a lot of those talks too. So we do these virtually and in person as needed. So.
Okay. And what about therapy? Is something you can do via Zoom as well? Because sometimes we have people in other states that are watching as well. So are they able to work with you?
Yeah, so we're currently licensed in Illinois, but we do have a pretty extensive referral network. So if there is someone who's looking for a provider, they're having a hard time finding someone, I would encourage them to reach out to us and we can direct them. Also, ASECT and STAR, which are the two major sexuality organizations, have directories of sex therapists based on where they're located. So if someone's in Idaho, they can look and see who is a sex therapist in Idaho, and that can provide it there.
My mom is in Idaho. It's funny
how convenient.
Mom, if you're on. And if people are in Illinois, but they just don't feel comfortable yet going to see someone in person, is that something they can do over Zoom right now?
Yeah, we offer all appointments via telehealth right now, and we use a HIPAA compliant portal. It's similar to Zoom, but it's not Zoom for all of our sessions. So yeah, it's pretty accessible for anyone in Illinois.
All right. Well, thank you very much for joining us. If you're just joining us right now, as soon as we end it, you'll be able to go back and watch from the beginning. But again, this will also be in Perimenopausal in a Pandemic. So thank you for taking time to join with us today.
Thank you for having me.